So now I'd like to introduce our speakers. First is Stephanie Brenden. Stephanie became an outsourced healthcare CFO with Eide Bailly in January of 25. Stephanie assists healthcare clients in managing, developing, and implementing accounting processes, financial planning, as well as growth and profitability strategies. Stephanie supports both rural hospitals and independently owned physician medical groups with ambulatory surgery centers. And then our second speaker is Jana Smith, and she's been a dedicated member of the Eide Bailly team since 2011, so that's quite some time. And she specializes in the healthcare industry. With her background in financial audits, cost report preparation, and advisory services, Jana leverages data-driven strategies to support healthcare organizations. Her expertise includes financial forecasts, debt capacity studies, market demand analysis, strategic planning, and service line financial pro forma analyses. So with that, I will turn it over to our speakers.
Thank you. Let's see if I can get this to work for us. Okay. Thank you for the introduction. Happy to be here. We are going to kind of breeze by the disclaimers here. The reality of what we want to talk to you about, I'm not going to go through all the session objectives, is we want to talk about where finances meet mission, right? And of course, you need a margin to have a mission, but also we want to kind of connect our viewpoints and our different backgrounds in terms of what are the financial strategies that I found to be really helpful and successful for my clients, regardless of where you're at right now. You might find yourself in a stable position from a financial perspective. What are the things you need to be thinking about? But you also might be in a spot of, I can't think about what's going to happen 6 years from now. I'm trying to get to next month. And so hoping we can give you some strategies, regardless of where you're at, to help you navigate the certain uncertainty of the next few years, for sure. And I don't really see that changing anytime soon. And then, of course, Stephanie, she's going to be able to bring the provider component, right? So she, more than I, has been in the trenches. She knows what it's like. She's been in a hospital setting for the vast majority of her career. So she can, make sure that we're thinking of everybody when we're talking about these types of strategies. So again, not going to read through all this. I'm going to spend a little time here because I think it kind of makes reason of the entire presentation. So again, I mentioned, if you can't think about what you need to be doing in the next 5 years because the reality is you're trying to figure out payroll in the next 2 weeks, what do you do? How do you break that down on a attainable, executable level? And then how do you do that? So what are some of those foundational tools that you can enact today when you leave here to help your organization? So that's that month-to-month outlook. How does that translate into 3 to 5 year outlook? And then what are the things that you can do from a financial perspective to make sure that you're capturing what you need to be, that you're doing your ongoing monitoring the way you need to be, and how do you use those analytics to improve your performance? That can be done through benchmarking, market share analysis, and just that general internal modeling or monitoring. Then you get to long-range planning. So if you think you feel stable and comfortable, you shouldn't. I don't know if anybody really feels like that right now, but there are always things you need to be thinking about. How do you maintain that long-range success? How do you make sure that if you are in a position where you're building excess cash, that you're doing what you can to make that cash work for you and your organization? Because margins are shrinking. It's harder to get paid for the things you're doing. We're seeing cost cuts everywhere. How are you mitigating those things? And even if you're doing all of those things, the reality is every day your infrastructure is aging. There are going to be new capital pressures that you need to be able to deal with, essentially. So we are in a world where construction costs aren't going down, interest costs aren't going down. What do you need to be doing to prepare for those major reinvestment needs and or growth expansion needs that you see as an organization? Anything else you want to add in here?
Can you hear me? Okay, great. So most of my career was at a critical access hospital. I was there for over 20 years, and I just wanted to share, we started out at PPS hospital. We became a critical access hospital during that period of time. And the most pivotal thing that we did when speaking of margin to mission was to focus on patient experience. and connect it to our strategic plan, to our dashboards, and that's where we grew from a small hospital with one clinic. We were still critical access, but we grew our outpatient program where our number of FTEs went from 250 to 700. And we had several clinics all over town, multi-specialty. We built a cancer center so that people didn't have to drive to the city, to do their chemotherapy treatments. But it was really that our community board made the decision that we were going to focus on patient experience more than anything else, and we'd spend just as much time looking at quality indicators as our financials every month at the board meeting. So that's what I wanted to start out with.
Absolutely. That's a really grounded way to start looking at things. Am I on? Can you guys hear me? Okay, sorry. Hopefully we won't do that the whole time. I'll become a Verizon commercial here. Okay, so first place is to budget with purpose. Every organization has different budgets in terms of how much you can spend on resources to help you and assist. So of course this is all scalable, but the core concepts of budgets are the same. And oftentimes I find that budgets become outdated before they even start. So reality is 3 months before year end you start, or maybe even earlier, you have conversations about what next year's budget needs to be. And then by the time you enact it and get 2 months into your next fiscal year, oftentimes it's already dated by 5 months. So I find a lot of times that clients end up reconciling back to their budget with their board every week or every month, rather than saying, okay, how do we react? How do we think prospectively about what we're going to do? And what is an efficient process for helping you do that? Okay, so it's outdated. Why? A whole host of reasons. It can be a payer mix change. It can be a funding mechanism that's changed. So if you have tax support and that's changed recently for better or for worse, that can immediately fundamentally impact your organization's metrics from a financial perspective. Grants, if you've had historically stable grant funding in any area of your business that helps support some of the services that you do, changes there can immediately affect your ability to execute on those initiatives. Excuse me, turnover. It's a reality that in our industry there is a significant amount of turnover, and when that happens in any position it can cause disruption, but there are certain kind of key stakeholders within your organizations that when there's turnovers in that spot, it just affects you financially. And so you have to be able to react to that in your budget, right? And you don't necessarily always get the opportunity to budget for turnover, right? Unanticipated capital costs. So think about, something breaking. The reality is that deferred maintenance can be part of that, and sometimes that can be predictable, but things happen. Equipment breaks, infrastructure changes. You may have something that just needs to be taken care of, and that can certainly throw a wrench in your budget. Project delays, so this can come in a number of different facets and variety, but from my perspective, I'm thinking about a construction project. So if it's supposed to be done in 12 months and it takes 18 months, there's legitimate real cost to that and disruption within your organization that can affect you and isn't necessarily always predictable. The same is within the EHR space. So implementations of any software conversion can be very difficult. And so if it takes longer, if it costs more, and I don't even know if I need to say if, maybe it's just when it takes longer and when it costs more, how are you able to react to those things to help mitigate that within your budget? The last two I'm not going to spend a ton of time on. Of course, regulatory changes are aplenty, and everybody in this room has probably heard the word inflation thousands of times at this point. And so all of these things can just make a perfect bingo card for disruption within your budget. And if you do it one time and it's a standalone document and you just continually go back to trying to meet budget without reacting to these other things and planning for them and making that part of your strategy, I think it's just a real missed opportunity. Anything from your perspective?
Yeah, I would just say that was another key pivotal point in the hospital that I was at, is we were spending a lot of time creating that annual budget, which, as you said, was wrong. The day after it was approved, something changed. We shifted to rolling forecasting, and we made the drivers, higher level, easier to update. We looked at it quarterly. Do we need to make changes? Do we not need to make changes? And again, just making sure that what we included in our budget was the patient experience goals, and what are the resources, the FTEs, the things to make that number one patient experience goal always be at the top of mind. It's easy to get distracted from those goals and those activities when you're just looking at, can we staff, the OR or the ER. So making sure those are built in and part of what you're looking at, every month, every quarter.
Absolutely. And if you really want to get into it, what is the root cause of why these changes and disruption matter? Like, why is a payer mix shift something that the patient would care about? How does that disrupt their way through your hospital? If a construction project isn't done timely, how does that disrupt their care? If they can't functionally get their bill timely because of a software conversion, how does that affect them? Like, when you go back to the root cause, it all does get back to that patient experience. And so making sure your conversations are rooted in that, I think, can be really helpful. I'm not going to read through all of this. I'm sure you guys will get copies of all of these pieces or the slide deck. So what I want to really touch on here is that, when we think about a rolling budget, that I think is a great functional way to make sure that you can continually budget, not really end budgeting, but continually be planning for the future. There are three categories. There's the budget that you had on a monthly basis. So usually when I think of a client's financial statements, on an interim basis, they have monthly budget, year-to-date budget, maybe last year-to-date actuals. And they're just all columns across the front. You can't change what has already happened in the first 3 months. The actuals are the actuals. Talking about how that can change is almost just a waste of time. So then the conversation becomes, when you have all three of those months laid out in front of you in a column view, and I'll show you an example in a second, you can see, does the budget even make sense anymore? Like, if we look from month 3 to month 4, and month 3 has actuals, and month 4 has budget, and they're just fundamentally not the same, why are we even trying to compare to that? And this also allows you just to have better conversations as a management team, as a board, and as an organization, because now you're talking about the thing that you can do something about rather than the reason why it's a problem. Okay? So when you identify that gap, for better or worse, you need to make some adjustments to the budget. Well, then you get into the root cause of what's changing. What disruption? Why is it outdated? Maybe it's turnover, maybe it's an unexpected leave of absence. Whatever it is, now you can start to say, okay, knowing what we know now, what do we think is going to change for the rest of the year? Is this a point in time for maybe the next 3 months we need to make a shift? What do we need to do? And the other piece here that I think is really important is to make it simple. Do not make this a process that takes a week to fill out, because then you'll never use it. It's just too cumbersome. You have too many other things that you also need to spend your time doing. It has to be efficient. So you'll see here, again, not going to go through and expect you to see all of this. Really, we're getting into the main categories. What are the levers that make it so that your organization is either successful or not from a financial perspective? And we can slice and dice it however we want to, but it's your net patient service revenue, which is comprised of volume and revenue per volume, essentially. And then you have all of the other kind of non-operating and operating income. That could be 340B revenue, that could be tax revenues, that could be grant revenues, investment income. Those key drivers you can pretty immediately identify and know. And then from an expense perspective, it's labor, right? Like, that's where the vast majority of all the costs go. And so is it a contract labor, is it benefits, and is it salaries and wages? Those three categories, I think, make a lot of sense to track. Outside of that, you really get into depreciation, interest, and kind of everything else. Rarely is something in the all other category the key driver of why something's not working out from an organization-wide perspective. So you can see we have some actual columns, some adjusted budget columns, and then we think in this case, maybe you could get back to budget. This example is from a hospital that is a smaller hospital, but it's COVID's a really easy year to pick. If your budget predicted in March 2020 was going to happen, I have questions for you. Talk to me after. So it just makes a really interesting kind of case study of like, okay, this happened. We know there's a major shift happening here. We think we might get some stimulus funds at some point to help mitigate this. And by the way, I need to know at the end of the year, are we going to meet our debt covenants? Like, can you help direct us to even try to figure out how to analyze something like this? This becomes a really easy and attainable way to do it. And the underlying pieces here are really a simple, like very few components. It's FTEs, it's payer mix, and it's, really like keying in your interim financials, essentially, once it's all set up. So it keeps it simple. Anything we should add here?
Yeah, another advantage of the rolling forecasting, keeping, again, those high-level indicators and all the things that Jana just listed to keep it easy to update. Mm-hmm. But also, if you are in a growth mode, mm-hmm. I mean, it's good for crisis mode, mm-hmm. Are we going to meet our debt covenants? Mm-hmm. It's also good for growth mode, yes. Because maybe you have pro formas that you've been working with off to the side for the joint venture you're going to do with the, independently owned physician practice, or if you're a critical access hospital, maybe you have a partnership with a university hospital and you're joint venturing with them on a cancer center or something. You have these pro formas going on the side, and the rolling forecasting, then any time of the year you can say, okay, what if we open, in this quarter of this period? You can easily flow, add those in and see what those impacts are going to be, and get your updated adjusted budget.
Yep, absolutely. And this actually kind of flows well into what you just said. So, there's that kind of month-to-month execution, right? So you're trying to build, a process for you to assess that and to project forward what you might think happened within a year period of time. The same can be done on a 3 to 5 year outlook, which is really helpful if you're looking at something that might be a little longer term, a growth strategy, or something that is not necessarily represented in a few months, right? It's a strategic shift. It could be a construction project, it could be a joint venture, it could be adding on some additional services that you want to have a little bit more specificity in terms of how you ramp those things up. You can do a similar process here in an annual format. Now, when you're looking about long-range pieces, I do think it's important to take a little bit of a consideration on the balance sheet side of things, just because oftentimes this comes with a cash outlay. Sometimes there's debt that needs to be acquired, or basically you need to get debt to be able to execute whatever initiative you're trying to look at. The other piece that I think is really nice is sometimes it can say, if we can stack these wins. So say you're using that month-to-month execution rolling budget, and you say, okay, if we achieve these goals on an annual basis, and I carry forward our results from year 1 to year 3, how does that improve our overall balance sheet? How does that improve our options on the table? How does that make us more stable as an organization over time? When I'm looking at the balance sheet, I don't spend a lot of time on inventories, right? Again, think about those key levers that you're really trying to predict and understand. Cash, investments, property. That's kind of it on the asset side. On the liability side, what is your current obligation? What are your current debts? What's your net position or equity position? Sometimes you'll have something else that does matter. So say you have a conversion or some sort of implementation, maybe then you want to look at days in AR and account for some shifts there, or days in AP, whatever is relevant to you. But think about those large levers. So then it also becomes exciting because you can start to play and say, okay, if we can achieve these goals, if we have this growth initiative and we execute it in this fashion, future state us is going to have so much more ability to deal with the volatility in our space, to take care of the patients that we want to in a way that makes sense. We have more options on the table. Anything else to add from here?
Yeah, I would think I would just, share when I first shifted to that rolling forecasting. It was hard for me as a CFO. The perfectionist accountant in me wanted every number in that budget nailed down and perfect, right? So letting go of or accepting that it isn't perfect and it's not going to be perfect, and don't let that perfectionism get in the way of your progress moving forward. So it was a little bit of a transition, but much easier to keep things updated. And the reality is that budget wasn't right anyway, even if you thought it was.
It all tied out, I'm sure. But no, and I think that's the reality too. This is a macro look at your organization, right? So you're not trying to catch every single thing that happens. You're trying to get yourself back to that strategic conversation about what do we need to do to be successful this year, next year, and into the future. And why does that matter? It all goes back to, well, if we want to be able to continue to provide care to the residents of our communities the way we have historically, or we want to improve that from where we are today, we have to address some of these things. And so again, it kind of comes from my perspective to how do we get to that meaningful conversation earlier with the information that we need to have on the table to make those decisions effectively. So this kind of takes us from that like budget with purpose wrap up, right? So the reality is you have to have a planning tool. Do not let budgeting become a static thing you do once a year and you just reconcile back to. If you spend all of your time reconciling back to budget and no time talking about what you're going to do next, I think it's a real missed opportunity for your leadership to be together, for your organization to use that time the best it can to position yourself in the future. I think it's just something that has to be done. And then update it monthly. That's just part of that proactive approach. You can't change the past. There's no sense on dwelling it. You certainly want informed and understanding of what happened, but don't do it every single month forever in terms of going back to month 1 of your budgeted year and still carrying all of those things forward. Run sensitivity modeling. I mean, the accountant and the modeler in me loves this piece of saying, what are the real key levers? If I change this number by 1%, the whole thing doesn't work at all. That's a number that we need to care about. And what are those key metrics? So say you, as a board, have some KPIs or things that you need to maintain. What's the volatility in the decision making we're making while maintaining those key KPIs? I know you guys talked about some of those things yesterday. Identifying those early and then allowing yourself to scenario plan really can help you hone in on the decisions that need to be made today and maybe the decisions that make sense to address again in a year. We talked about debt covenants, but I guess maybe we haven't. The reality is the debt covenants can be a key piece here. So if you're going to have a concern where you have debt and you're worried about whether you're going to maintain those covenants, or the next session is all about the volatility that's probably going to occur and is already occurring within the healthcare space, trying to quantify how those things could impact you, getting ahead of those conversations and saying, based on what's out there right now, this is how negatively it could be for our organization, using that modeling as a tool for conversations internally for planning, but then also potentially for advocacy at a larger level and saying, hey, just so you know, this is the real downstream impact of what I think could happen to us if we don't do something now. All of those conversations become a lot easier if you already have something quantifiable in front of you that you've kind of done the legwork on. And then alignment with your strategic plan. So this is a perfect segue into what Stephanie can preach to and talk from experience about as well too. But making sure that you're not just going for margin and then connecting it back to your strategic plan and saying, well, this has nothing to do with the things that we set out to accomplish when we all sat down a year ago for our 3-year strategic planning goals. These were not our priorities. Doesn't maybe mean that you don't still do some of it, but it requires a conversation and saying, how does this align? If it doesn't, why does it matter to us now? And how does this affect, much more broadly than just the finances?
Yeah, this is where, we had really made some changes. I think in the early days at the hospital that I was working for, the strategic plan would be completed, and then it was literally put in like a 3-ring binder and stuck on the shelf. And I don't think anybody looked at it, for the next. And then after 3 years go by, oh, did we hit anything? So we made the strategic plan really this living document that we're updating every single month. that we were communicating with all of our managers. Our employees had visibility into, what our strategic plan goals were and those key metrics that went along with the strategic plan. We would have the, even on the TVs in the cafeteria, like where are we? Where's our progress against the goal? Where are we on the strategic plan timeline? And most of those goals really were focused on patient experience. We were, maybe some of you have heard of Planetree, but we use the Planetree program for Planetree designation as our roadmap for patient-centered care. And I think I heard a lot about, Providence yesterday. In yesterday's presentation, they had developed their own way to do patient experience. So you don't have to do, a program like Planetree. That was just what our board chose to do. And we achieved that, designation and that gold seal for patient experience. Some of it was cosmetic and the things like pet therapy, that we added. But I think I feel like the most important thing we did was we implemented a patient advisory council. And we also did patient focus groups on a routine basis. The patient advisory council really surprised me in that, we really got so much involvement from our community on the mission and vision of moving the hospital forward on these goals. Many of them also became volunteers. So we grew our volunteer pool at the same time we were getting advice from our community members and more involvement on, improving the patient experience at our hospital. We would show them these are the new patient statements once we convert, our EMR, and get their input on all of those things. Wayfinding, every time we did construction project, we'd get their input on wayfinding. So I think we just did a much better job hearing directly from our patients and then building those goals into our strategic plan, our budget that was, again, a living document, constantly updated, constantly in front of everybody. Our quarterly operations meetings with all the management heads, it was not so much on explain your variance actual to budget. It was more where are we on our strategic plan goals, and how have we improved our patient experience? And maybe what do we need to update in our rolling forecast so that we don't miss it?
Absolutely. And one of the things you touched on too is, and from my mind, I think about, a lot of those things that create a really meaningful patient experience maybe don't have a great funding mechanism attached to it, right? So the more you can make yourself financially stable, the more ways you can diversify your cash to allow for those shortfalls that might exist. Say, if this payer isn't going to pay for pet therapy the way we would need it to be, how are we going to do that? Because it's important to us, because I think it matters to our patients, and I think this can be a really unique thing that we can do that maybe not everybody else can. How do we bridge those gaps when those things occur too? Okay, we're getting out of budget with purpose, and now we're talking about kind of that ongoing monitoring. So this is that data, using data to help make sure you're staying on path. Again, these are just examples. I know you talked a little bit about dashboarding yesterday too, so it's not so much about what's on this specific screen. It's more about making sure you have those things that are meaningful to you and your organization measured. So we can talk about financial metrics, of course, but again, those are things that probably you're more familiar with. I think the other piece that I see often missed, particularly from a financial standpoint, is we can get really good at data mining our own data, but we don't necessarily think about what we might be missing. So that comes back to market share. State hospital associations oftentimes give you access to that. So make sure if you have access to that, you use it so that you can assess the opportunities within your market. And so what does that mean? I mean, oftentimes people think they have 100% market share. That's just not true for literally anybody. So then the question becomes, hey, if our therapies practice has been growing by 10%, but in reality the overall market has grown by 30%, you're actually losing market share. So making sure that you're addressing your community needs so that they can have those cares done locally or with an organization that they've already chosen to have care from is in the patient's best interest. And there's also certain things, depending on your circumstances, geography, everything else, certain services you don't want to have to travel for. And so if those things can be done closer to home, you want to make sure you know about those things. Benchmarking from a financial perspective, I also do think is important, comparing yourselves to like-minded organizations, whether it's within the state or number of beds or similar, net or gross revenue perspective, making sure that, you guys are somewhat in line with your peers. And if not, why not? And maybe it's that you're kind of the gold star in certain areas, but aren't in others. How can you work together? How can you collaborate even in this room to say, hey, I saw that you guys did really well here. How? And use those relationships to help each other. Statistics, again, be careful. Statistics are people. So making sure you're taking care of those patients the best way you can and not just seeing them as literally a widget is certainly in your best interest, but also just monitoring those volumes over time can really help you understand trends that might be happening, and then understanding how you can best support those folks. And do you want to touch on quality metrics?
Yeah, I think, again, our board had decided they're going to spend just as much time discussing quality metrics as financial metrics. So that really shifted, the focus of the organization. It was a little uncomfortable, I would say, at first, that, we're going to be publishing some of these quality statistics and indicators where our employees are seeing them too, both internally and externally. And yeah, anybody can go online and see certain metrics if they know where to look, with what's required to report to Medicare. But we reported more than that internally, and we really did some education with our employees about those indicators and their role in impacting those things. And so I think, again, that was just sort of the shift of the focus, which then did, in the long run, really help this critical access hospital to grow and be very successful.
Well, and what is measured is often improved. And, again, getting to that crucial conversation earlier, if we aren't doing well in a certain area, it's not a conversation of why didn't you do this better? It's how can we make this better and take that team approach of saying, if we're having a specific issue in our quality metrics, how do we as a group make sure that we can address this better? Because it has downstream effects for all of us. Again, these are just examples. So one thing I like to do with clients is measure market share over time within a specific, geographical area. So you can say, hey, how have we been performing in any specific area? So this can be done on a service by service perspective. This can be done entity-wide. The reality is also that, you don't necessarily even want 100% market share. There are partnerships that you have that are meaningful. So again, at the end of the day, if a patient has a critical need that is best served outside of your organization, those things should be happening. That is not the purpose of basically looking at your market share and making changes. It's more of saying, where are the opportunities where we're sending our patients elsewhere or they can't get in timely, so they are making other decisions with their care. How do we strategically look to best care for our patients? And then again, over here, that benchmarking, probably a lot of the similar KPIs and things that you looked yesterday, again, really small print. But the idea is, you should be doing this over time with your organization, but then also have some sort of benchmark that you're comparing to. I used to do this exercise and say, is this a favorable result? Is this an unfavorable result? And kind of color code, green, yellow, red. And I stopped doing that because the reality is, it's not necessarily always true. So if the whole thing's green, yeah, you probably are in a good spot. If the whole thing's red, yeah, you probably have some problems. But the reality is strategically you make specific decisions knowing that there can be an impact to a financial ratio. For example, if you undergo a replacement hospital construction project, go get a bunch of debt, yeah, your debt service coverage ratios are going to drop from where they previously were. In the first few years of you being in that new space, maybe your debt service coverage ratios aren't where you want them to be. But that was a strategic decision to make sure that care is delivered in the way that you want it to, both today and 30 years down the road. So it's not necessarily about whether there's good and bad metrics. The only thing that I get really concerned about is if you have no idea why any of it's happening. If you don't know why, a result has occurred, that's when you need to do a little bit more digging. Okay, anything we should add to from there? Are you good? Okay, so now we're getting into, we've talked month to month, we've talked, that 3 to 5 year range, we've talked about, within that space, how you can make sure and optimize, resources that might be available to you, whether it's through your state hospital association market data, whether it's part of groups that you're participating in to intentionally share data with each other, and or purchasing services to be able to get access to that data, along with on the financial side, measuring yourself over time and measuring to other peers like you to make sure you're kind of staying where you need to go. The other major piece that we need to talk about is kind of the cash flow side of things. So from my perspective, budgets are often very heavily income statement focused, but there are certain specific cash outlays that every organization has, and you need to plan for those as well too. And oftentimes that's the place where you can kind of eventually diversify cash and or have the ability to react as an organization to periods of instability and or plan for the future in terms of construction projects, implementation, whole host of things. Okay, so you'll probably see this as familiar from a couple slides ago. At the bottom, I often say add some element of a cash flow. Depending on the size of the organization, what you got going on, it can shift, but again, keep it high level. So always you're gonna have a capital expenditure budget. The reality is things are gonna happen. Equipment's gonna break, you're gonna need to invest in new equipment to be able to increase productivity or assess and capture growth that you've already identified. Infrastructure changes, things come up. You have a capital budget. So making sure that's part of this cash flow assessment, principal payments. So if you have any sort of debt, interest is on the income statement, debt is not, so making sure you're accounting for those pieces. If you have reserves that you need to be funding, whether it's a debt service reserve, a repairs and maintenance reserve, whatever those cash outflows need to happen for basically limiting the use and access to that cash for any purpose, you need to make sure you're accounting for those things. And then what else do I have up here? One-time payments. So the other thing to consider is, if you're doing month-to-month planning and you have certain expenditures that don't happen in equal increments, you can't just divide by 12 and put it on there. If you know you have some event that is going to happen at any particular time, getting those listed there becomes really helpful in both helping if you think, oh my gosh, this looks terrible, what are we missing? And or on the other end, we're having a banner year. Remember, in month 9, we do have this other expenditure that or cash outlay that we need to be remembering. Anything else you want to add into here?
I think for cash flow planning, this is definitely a CFO's best friend, I would say. You've got to have this. And things like construction projects. So more recently, assisting a large physician-owned medical group in building a second ambulatory surgery center. And if anyone's ever been through the approval process to open an ambulatory surgery center, you are at the mercy of the Department of Health and the CMS, accreditation process. And you also may have construction delays because of those requirements. And even though the plans were previously approved, at the last minute, they're going to say you need to change something, in the construction plans. That's just part of the process. So being able to quickly update that cash flow plan, and maybe you're in an interest-only construction loan, but the principal payments are going to start, in X month. So being able to quickly, manipulate and update those numbers, and maybe you're going to be paying rent for the space a little bit longer with no income coming in, and how are you going to manage through that process, and what are the levers you can pull to help you through that?
And this is just an example of how it can all kind of work together. It becomes really helpful because at the end point you can see, okay, what's our projected year end in terms of net income, but then also what is that doing to our cash and investments during the same period of time. So it doesn't have to be done in Excel, certainly could be done in Excel. Depending on the size of your organization, there are a whole host of tools that you could use to help you do some of this as well. But the reality is that the process stays the same regardless of size. It's the methodology that's really important to consider. Okay, so what are the other reasons why you need to do cash flow planning? I think from my perspective, we were talking about this a little bit earlier as well too, you can identify opportunities on how you can assess and improve your cash flow planning as well. So that could be something as simple as looking at partnerships. How do we improve cash position and our ability to stay stable by working with each other, even within this room? Like, what could we do together to help ourselves with that? How do we identify grants and other funding raising opportunities that could really be helpful in assisting with cash flow planning? How are we going to invest? So the big one that I always see is if your cash is not, if you finally gotten to a place or you're at a place where your day's cash on hand is very sufficient for your operating needs on a regular basis, what are you doing with that cash? If it's just sitting there, it's a huge missed opportunity. That is one of the best ways that you can help with the shortfalls that happen on other funding mechanisms that are really important but aren't sufficient to, say, add on to some of those patient experience pieces. So those dollars that get invested and provide return to you are often the funding mechanisms for all of those other things that really make a difference from a patient experience standpoint and set you out from others when folks are trying to figure out where they prefer to have their care done. We were talking about this earlier. The facts are patients don't necessarily want to be in the hospital. Like, you're already dealing with a group of people that is sick. They inherently don't feel well. And anything you can do to differentiate yourself so those folks feel better in your space is a huge win. And being good with that cash flow piece and thinking about ways how you can improve that outside of, your commercial payers or government payers or reimbursement mechanisms, or all of those things need to be done. But even still, we're seeing more and more contraction in that space. And what are you going to do to kind of balance that equation without sacrificing patient care? On the other side, that long-term planning piece, to be able to even begin to think about contingency planning for when, bills come into play that you weren't expecting 2 years ago, or funding cuts happen, or turnover happens, or you acknowledge that you need a major capital expansion. All of those things require stable and growing cash. Anything else you want to add here?
I would just say for, the grant writing and the fundraising piece, that was another thing that with really focusing on patient experience and tying all those goals into our strategic plan, having that patient advisory council and all those processes, we were really able to put all of that together and quantify that, and all of a sudden grant writing and asking for donations for a fundraising project became much easier because we already had all of the data. And we could prove and show what we were doing and the results that we were achieving, and so then that led to increased funding for new projects and new construction. So just tying that in.
Yeah, absolutely. And I think this is also a great place. The more you've done in this space to show where you've been historically, what your challenges are currently, and measuring all those things just gives you a much better footing to advocate for yourself, for the industry, for your specific organizational needs on a much better and easier footing. To just say I need help, but then not really have anything other than kind of tangential conversation to support that, it doesn't become as meaningful. It's really hard to ignore the facts that you've already gone through the work to be able to provide and show. The other piece we haven't talked on at all is technology upgrades. So I did touch on some implementation, things like that, but the reality is that there's major technology concerns, opportunities. The reality is it's going to cause some sort of disruption within our organizations. It already is on some level. And so if you're not in a place where you can invest in those technologies to be on the forefront and keep up with the rapid change of pace that that specific industry is going to have on the healthcare industry, I think it's safe to say you're going to be left behind, and it's just going to become more and more of an expectation from your patients that these things are available within your organization. And so I know there's a conversation, I think, later about AI and how that might impact our organizations. At the end of the day, the way you are able to keep up with this space is to be able to have excess cash to be able to devote to it. So if you're just in a spot where you're trying to maintain where you're at currently and not thinking about the new things on the horizon that are going to potentially fundamentally change how all of us receive care, would just be a big oversight. So just more reason to make sure you're being very strategic and intentional with cash.
One of my medical groups that I work with, they have recently implemented an AI agent called Olive that answers the scheduling phone calls.
Yeah.
And so it actually has reduced, the number of calls that the schedulers need to respond to, because a lot of the calls are a reschedule, or a canceled appointment, or those types of things. So watching the success of that and how rapidly those things are taking effect. So again, being strategic, maybe it's worth investing in AI for your call center, but you will probably likely save costs on the back end, or be able to redirect some of those FTEs to, maybe denials management or something.
Yeah.
So, although AI is coming in denials now too, so more on that later, of course.
Well, and this is another perfect example of where that rolling forecast modeling is so important, because if we were to talk even 2.5 years ago about AI versus how we talk about it today, it's entirely differently. The rapid implementation and change within that space is daily changing. And so being able to capture some of those things and run sensitivity modeling and say, hey, we get an Olive, what does that do to Jana in a certain other area of our business? And how does this help our organization or hurt our organization? What are the pros and cons from a financial perspective? But then also keeping in mind your employees, taking into consideration, how do we make sure we're taking care of them on some level too? How could we repurpose her skill set within our organization to help us in this next initiative? Because I think the other piece here is that AI doesn't just happen overnight. Not everybody inherently knows how to use AI. So what is that transition period like, and how do you find people with the skills necessary or teach those skills necessary to help in the implementation of AI in all of our work streams as well too? Okay, so now we're on the last bucket here. We have a little bit of time left. So I'll take some time on this piece, but I won't get into the ton of detail. The reality is you're also going to get to a space where you're going to need to make some capital upgrades. It could be an expansion opportunity where you say, this is what our community is going to need from us in the next 10, 15 years. How do we prepare for that? Because you can't just make a building overnight. It's oftentimes a 5-year process just to even remotely get into it can vary in time frame. I've worked with clients where it's taken 5 years to get to a point where you got a loan to get in the ground to do the project. And then depending on what you're looking at, and if you're renovating or you need to expand to a current footprint, you can't just disrupt all of your workflows. You can be working in phases over many years of time to accomplish all the things you're trying to do. So even now, when you got to the spot where maybe you've diversified all your cash, you're creating great margin, you're able to do those patient-centered things that having that excess cash flow can allow you to do. Whenever capital projects come calling, they don't come with a small price tag. So you're going to have an element of an equity contribution likely, and then you're going to have probably some loan proceeds that you need to consider as well too. So if you're trying to figure out, are you in a spot where you might need to be considering whether you have a capital need outside of your normal capital budget of your routine purchases, here are some of the areas that we often see pointed to. So you have a structural issue. It's an infrastructure change, or it's just aged over time. You have to address it. You're not up to code anymore. That's simply put, you need to address certain things from a facility perspective to make sure that you're complying with regulations. Capacity and space issues. Sometimes nothing grows exactly as you'd planned. So maybe you have one area where you are severely under space for the volumes that you're carrying through that space. And then in another area of the hospital, it just didn't pick up like you thought it would and you have excess space. Right sizing those areas takes time, takes effort, takes sometimes some construction. Technology and equipment. So if you're in an aged facility, the industry didn't think about the space that you might need for certain pieces of technology to be within a room. So sometimes it's literally as simply, we don't have space for that machine here. We have to do some reconfiguring to address that issue. Accessibility. Is your ER on the second floor? Do you have physical therapy on the far corner of the building and you have to walk 1.5 miles to get there? Those are accessibility things that can impact your ability to basically take care of patients the way you want to in a way that makes sense for them. And then maintenance history. So if you're looking at your maintenance costs and your utility costs per square foot and they're just skyrocketing, that's an indicator that you probably have some infrastructure or other needs that you should consider looking at. When I'm looking at our other piece here, it can really fall into 3 buckets. What are your current services? Are you trying to expand an area? Are you trying to divest of an area? Are you trying to basically look at from those current service planning pieces? What are the facility challenges? Is it just an aged building? Do you have inadequate space for certain things? And then what are you going to do about it? So, of course, your first step shouldn't be, let's build a new building. You want to think about the cost to execute some of these things. Start small. If you just need to move a wall, just move the wall. Don't do some huge construction project for no reason. Partially because, again, they're really expensive and you're making a decision on the behalf of your organization that's oftentimes going to go far beyond your career. So you're making decisions that the next CFO, the next CEO, the next leadership team over the next 30 years is going to have to be responsible for paying back. Take that seriously when you're trying to think about the care that you're providing, the employees that you employ within your community, and ultimately the patients that you're caring for. Anything else you have in this section?
Just the story of the critical access hospital I've been sharing. I think that the whole time I was there, it was over 20 years, and we would talk about we need a new campus, we need a new campus, we need a new hospital. But a lot of that, it never came to fruition at the time I was there, but we knew we needed to improve our patient experience, grow our outpatient and ancillary services. We added the cancer care collaborative with the university. We were able to grow the margin to the point that actually right now, this hospital is under construction for a new building. So it finally, I'm not there anymore to enjoy it, but it's finally come to fruition. But I would say that was a 30-year journey to get to this point of a new campus under construction. So it is possible out there.
Absolutely, and I would counter that the decisions your leadership team made to be fiscally responsible for how you grew and where you spent your dollars allowed for that leadership team today to be able to say, yes, this makes sense. We do need to build this new facility. This is the time. And so it just goes back to that continuum of making sure you're leaving what you were working on at that point in a better spot than where you were when you started. That's always the goal, right? So, or at least as good. Okay, again, small writing, not going to take you through all of this, but say you got to this point and you say, yeah, no, I think we're in a spot where I know we need to do a major capital project. How do I start? So we start here where we started today, which is evaluate your current financials. Okay, so think about your KPIs, think about your current indebtedness, think about all of the things from your revenue and expense trend line, how that affects you today and into the future. So if you have really unstable financials and you're trying to access more debt, it's going to be more difficult. If you've done kind of the legwork and you're into that stage where you feel like, yes, we're a stable organization, we have identified that this need is not something we could, fulfill in any other way, now we need to move forward to the next step. The next step is looking at your available capital and internal funding resources. So and I mentioned this previously, the reality is that any major loan that you get is probably going to require some sort of equity. I'm making up numbers now. Say you wanted to do a $50 million project, you're going to have X million dollars in cash that you are willing to put in, and then the remaining needs to become some sort of loan. So the question becomes, how much excess cash can you part with responsibly? So that usually comes from either having minimums on a day's cash on hand perspective and a minimum on investments. If you separate those, depending on how you're invested, could impact that decision as well too. And then if you take out the remainder in debt, what does that look like? How does that affect debt service coverage ratios? How does that affect our cash position over the long range? What are and then the next piece here is, analyzing your revenue streams. So say you're a critical access hospital, you do have some elements of cost-based reimbursement. So identifying your debt capacity in a critical access hospital or in a space where you do have cost-based reimbursement allows a little different analysis than you might have otherwise. But the same concept applies regardless. What is your payer mix? What are your commercial payers? What are your government payers? How are those funding mechanisms changing today and over time? Are they shrinking? Is there an opportunity for growth in any of these spaces? If it's not coming on a, revenue per stat basis, do we have an opportunity to increase our stats and our utilization? What do all these things look like? Eventually, you kind of get to that debt capacity number. So as you kind of start fine tuning down the road, you essentially say, okay, what's an average year for us today? Let's layer on in the future, if we were to execute this construction project, what are our opportunities for essentially additional margin or bottom line? And where do we as an organization feel comfortable from an indebtedness perspective? All that changes based on who you are, the specifics of your loan terms, your board, your community, your risk management, and just generally direction that you want to go. And then as you get to the end, you kind of start to fine tune things. You get a little bit more specific, and oftentimes I spend a lot of time in this space doing essentially exam and forecasts, but it's essentially an audit of the future. So it's taking you through the financial story of executing on a construction project, current state, through construction, future state. What do your financial statements look like if you're executing on all of these things? And you've already talked to architects, you've gotten a budget done, you know the spatial changes that you're planning to execute. You can get a little bit more, you can get a little bit more granular in what those conversations look like. Not going to spend a ton of time here either, but if you are in a spot where you're looking for different lending types, there's plenty. You can do, I would qualify them as either government or I guess bonds essentially. So you can do USDA funding, you can do HUD funding, you can do GEO bonds, you can do private placement, you can do revenue bonds. There's a whole host of avenues out there. They have pros and cons. All of them do. A lot of this sometimes depends on your financial stability to start with. USDA and or government lenders are a little bit more lenient in terms of that instability piece and working with you through that. They oftentimes have, not oftentimes, they almost always have better financing terms that are available to you through their programs than are on the general market. But again, all that depends on financial stability and where you're at as well too. Sometimes the urgency matters. So if you have a critical need that needs to be done in the next 8 months, oftentimes USDA planning or HUD planning just takes longer to get through their application period. It's stringent, I'll just say it that way. And then following execution of that agreement, there are compliance reporting requirements that you have on an ongoing basis that are just kind of become part of your financial statement audit. And then outside of financing, there are other funding sources, so you can find grants that are used in connection with construction projects. There's not one great resource that I know of that you just go to XYZ website and apply, but at least knowing and looking for some of those opportunities is really helpful. Capital campaigns, I've touched on that a little bit, I think, but oftentimes there's some sort of community capital campaign that connects with a construction project as well. And then, sales tax or property taxes, sometimes we'll see that, they'll essentially pass an increase in taxation to help support with some of those debt financings. And then the last one I'm not going to touch on much at all, but it's essentially programming that might be available for having energy efficient projects. And at the end of the day, you can essentially qualify for the overall cost to your organization to decline. Okay, we have 5 minutes. Questions? Anything else that I missed that I should add, or you should add?
I think we talked a lot about, the growth and the funding and financing cash flow. On when you're in the crisis mode, just wanted to kind of reinforce that cash flow planning, rolling forecasting. If you can easily update or change payer mix. I think we're going to be hearing about what's going on in Washington State here next, and Medicaid funding on the federal and the state level is definitely a hot topic. So just another thing to consider, that if you are doing that rolling forecasting and you have good data and modeling on that of how these things are going to impact you, you're in a better position to plan for it, mitigate it, pull other triggers, but you're also in a better position, to get involved with advocacy, as needed. So you've now got data, and maybe people will listen, when they can see, the modeling that you've done. So just another thought.
Yeah, absolutely. I think the big key here is that we don't have all the answers. I don't know if anybody will have the perfect modeling. I don't know if we'll get to the perfect budget for how to deal with what's going to come next over the next course of the year, or 2 or 3 or 5 or ever. But if you have good processes in place and methodologies in place, you can at least start to identify where you have vulnerabilities as an organization. And even I've thought about from a patient perspective. So say there's going to be some cuts in the Medicaid space. How do we make sure that those folks who can have access to another type of insurance get that? How do we facilitate that vulnerable population to make sure that they are covered in another instance if they can be, and if they can't be, let's identify those folks early and often where we can appropriately to make sure that we can help them get the care that they need. And as an organization, we can stay, solvent and do that with them.
Yeah, again, maybe if you have Olive helping to answer the phone calls, you can shift some staff to help navigate, patients through that application process, and helping them find the benefits that they need.
Okay. Oh, we got one question, or maybe.
Thanks for the presentation. So quick question on the rolling forecast in terms of the granularity, right? So let's say you have a major payer mix shift or reimbursement change, and then you are like, okay, well, I'm going to have to contract my FTEs by 10%. I'm going to have to reduce supplies expense by X percent. And flowing that through the system in terms of holding your local leaders accountable, do you actually flow that through the system down to that granular level, or do you use other systems like productivity tools to manage that?
Yeah, this does not replace productivity. What this would do is work in connection with somebody who, say you have your productivity group and they've identified that, hey, we're way out of line, making something up, in lab. And they identify, like, I think we need to right-size this department. What you could do is then flow the results of that conversation back through your modeling and say, okay, talk to lab. Through productivity, we've identified that we can, I guess I'm going not the growth opportunity outside in this setting, but saying we need to remove 1 FTE from lab. I then say, okay, if we do that and we maintain our lab volumes, that impact is X dollars to our rolling forecast model. So I'm, again, making numbers up. Let's say we save $75,000 in this department. We can show the decrease in FTEs by 1, valued at $75,000. Keep all the revenue the same because that's the productivity piece, and then you can flow that forward and say, if we maintain productivity and create this essentially efficiency, that $75,000 spread over the last 8 months of the year is valued at X dollars, and then you can see it kind of flow through. So it's not a one-stop shop to fix all of your problems. It is intended to be like that high-level look and say, okay, or even payer mix shift. So if you're saying, we know we get paid X overall by Medicare, Medicaid, and these commercial payers, if we have a huge shift from commercial pay to Medicaid, or Medicaid to commercial, or Medicaid to uninsured, what's that relationship? Is it going to be a decrease in overall payment per stat, and then potentially an increase in bad debts? What does that look like? That's where you would see it. So essentially, from my perspective, it's on a gross revenue by payer basis, a contractual by revenue basis, and then understanding how those metrics work. What are the contractual payments? Is there cost-based reimbursement? Then that obviously is a different mechanism than if there's not. And then considering if you go to an uninsured population, how that might affect your essentially bad debt as a percentage of net patient service revenue. So if you're at X percent now, what would it mean if that were to go up by 0.5% or whatever the number is that makes sense for your organization? Did that answer your question?
Any other questions for our speakers? All right, well, let's give them a huge round of applause.